Pain is one of the most common reasons people reach for medication. A sore back after a long day, a throbbing headache, joint pain, or muscle soreness after activity can quickly interfere with daily life. When that happens, many people turn to over-the-counter pain relievers. Two of the most widely used options are ibuprofen and naproxen. At first glance, they seem almost identical. Both reduce pain. Both reduce inflammation. Both are available without a prescription in many places. Because of this, people often assume they work exactly the same way, but in reality, there are some important differences between the two. Understanding those differences can help you choose the option that may work better for your specific situation. Both ibuprofen and naproxen belong to a group of medications called nonsteroidal anti-inflammatory drugs, often shortened to NSAIDs. These medications reduce inflammation in the body by blocking enzymes involved in the production of substances called prostaglandins. Prostaglandins play a role in pain, swelling, and fever. When their production is reduced, inflammation decreases and pain often improves. Although ibuprofen and naproxen work through a similar mechanism, the way they behave in the body is not exactly the same. One of the biggest differences involves how long each medication lasts. Ibuprofen usually works relatively quickly. Many people begin to feel relief within about 30 to 60 minutes. However, its effects typically last around 4 to 6 hours. Because of this shorter duration, ibuprofen often needs to be taken more frequently throughout the day if pain continues. Naproxen works a little differently. It may take slightly longer to reach its full effect, but it tends to stay active in the body for a longer period of time. In many cases, naproxen can provide relief for 8 to 12 hours. This longer duration means fewer doses may be needed during the day. For people dealing with ongoing discomfort, such as joint pain or arthritis, that extended relief can sometimes make naproxen more convenient, but duration is only one part of the picture. Another difference involves the type of pain being treated. Ibuprofen is often chosen for short-term, mild to moderate pain. It is commonly used for headaches, dental pain, muscle soreness, minor injuries, and fever. Because it works relatively quickly and is widely available, many people use it as a first-line option. Naproxen, on the other hand, is frequently used when inflammation plays a larger role. Conditions such as arthritis, tendon irritation, or persistent joint pain may respond well to medications that provide longer anti-inflammatory action. This does not mean one medication is always stronger than the other. Instead, it reflects how long their anti-inflammatory effects remain active. Another important factor is how the body tolerates the medication. Like all NSAIDs, both ibuprofen and naproxen can affect the stomach. These medications reduce protective prostaglandins in the stomach lining as well as those related to inflammation. As a result, some people may experience stomach irritation. This is why they are often recommended to be taken with food or after a meal. For individuals who use these medications occasionally, stomach problems are less common. But when taken frequently or in higher doses, the risk of stomach discomfort, irritation, or even ulcers can increase. There are also differences in dosing frequency that influence how people use these medications. Ibuprofen is typically taken every 6 to 8 hours if needed. Because of this shorter interval, it can be easier to adjust the dose based on how someone feels during the day. Naproxen, with its longer duration, is usually taken less often once or twice daily depending on the dose. For some people, this simpler schedule makes it easier to maintain consistent relief. However, the longer duration also means the medication stays in the body longer, which may be relevant for people who are sensitive to NSAIDs. Another detail people sometimes overlook is how quickly pain relief is needed. If someone develops a sudden headache or muscle pain and wants faster relief, ibuprofen may be the preferred option because of its quicker onset. If someone expects pain to last throughout the day, such as after a strenuous activity or with chronic joint discomfort, naproxen may offer more sustained coverage. Age, existing health conditions, and other medications can also influence the best choice. For example, people with certain heart conditions, kidney problems, or stomach issues may need to be cautious with NSAIDs in general. In these cases, the decision about which medication to use or whether to use one at all is best made with guidance from a healthcare professional. Another key point is that taking multiple NSAIDs at the same time is generally not recommended. Because ibuprofen and naproxen belong to the same medication class, combining them does not usually provide extra benefit and may increase the risk of side effects. Many people assume that if one works well, taking both might work even better. But in reality, this can place additional strain on the stomach, kidneys, and other systems. So the real question is not simply which one is stronger, the more useful question is which one fits the situation better. If pain is sudden, mild to moderate, and short-lived, ibuprofen may be a practical choice because it works quickly and can be spaced out in smaller doses. If pain is more persistent and related to inflammation that lasts throughout the day, naproxen may provide longer-lasting relief. With fewer doses, the key insight is that these medications are tools designed for slightly different patterns of pain. Understanding the timing of your pain when it starts, how long it lasts, and how often it returns can make it much easier to choose the option that aligns with your needs. Instead of thinking about these medications as competitors, it can be more helpful to think about them as options designed for different scenarios. Pain management often works best when the approach matches the pattern of the problem. By paying attention to duration, frequency, and the type of pain involved, people can make more informed decisions about when and how to use these medications responsibly. If you found this explanation useful, consider subscribing to the channel. The goal here is to break down everyday health questions in a clear and practical way so they're easier to understand, and if you want to explore the topic further, there's a helpful resource linked in the description that provides additional information you can review at your own pace.